Insights from the world's best medical minds. This is the rightdoctors.com.
Welcome to the special COVID-19 pandemic podcast on the rightdoctors.com. Today we have with us a pioneer laparoscopic surgeon who has successfully performed more than 80,000 surgeries till date. Dr. Pradeep Chaube is the chairman, Max Institute of Minimal Access, Metabolic and Bariatric Surgery in New Delhi. He is the first to introduce an obesity surgery facility on the Asian continent and was also unanimously chosen as the first president of Obesity and Metabolic Surgery Society of India. Dr. Chaube has been featured in the Limca Book of Records for his work from the year 2000 to 2019 consecutively. In the podcast, I present to our audiences Dr. Pradeep Chaube from Max Institute of Minimal Access, Metabolic and Bariatric Surgery, New Delhi. India has reported more than 2,000 active cases of COVID-19. What is your take on this?
Well, I think it's an infectious infection by the coronavirus, COVID-19. And because some of the countries were not very well prepared, I think it is spread dramatically and to the extent of causing a pandemic situation. But yes, we have to understand that it is a very serious infection caused by COVID-19 virus and is highly infectious.
What are your views about the 21 days lockdown that has been implemented by the government, and why is it important?
The decision taken by our Prime Minister Modi is very bold decision, which is absolutely scientific, and it is in need of the hour to prevent sufferings, problems and losses of the Indian citizens, families, and it's a very welcome decision. And I feel that this is the only way out to prevent this pandemic situation and to curtail the number of cases in our country.
How people can utilize this lockdown?
Well, I think first of all, one should not panic about the lockdown because all the essential services will be available to each and every one, maybe even at the doorstep. So I think there's no crisis, there's no shortage of anything, may it be medicine, may it be the daily products which are used in day-to-day life, and maybe the entertainment part in terms of digital support, internet and social media. So I think it should be taken with a lot of optimism. One should not get into the panic mode. I think first 1 or 2 days were a little difficult because we needed to get into that mode of so-called inactivity from the job and travel. But I think this is, I would say, is a very, very important 3 weeks of anybody's life, which may look a little difficult at the moment, but I think if we used in a proper manner, I don't think we will ever regret, and this is going to be a great sort of time for so many activities and so many recreational activities to be done.
Sir, how are you dealing with this lockdown?
Well, I think it takes being my profession as a surgeon, as a doctor. I think we were initially involved with preparing the hospital and the facilities and the game plan to handle this unexpected serious situation. But having spent that time, and now I think we are reasonably well prepared as far as our plans are concerned. Now we have little time to think. What I have utilized this time as a time of really pleasure with the family, with your children, with your spouse, with your grandchildren, with your pets. So it's a golden period, I would say, and it should be taken like that. We should reinvent ourselves. We should rediscover ourselves, and because otherwise you were spending weekends or Sunday with the family, or you were going on a holiday, which are again entirely different. Going on a holiday is entirely different, but spending all your time with your own family members, with your own staff, I think is a great opportunity to reinvent and know each other well, and realize how valuable they are, and also for your introspection. You should do an introspection and see what things were not right, what habits were not right, what you wanted to do as a hobby, what you wanted to do for your family, investment, your business, your hobbies. You can plan your holidays, how you would like to spend your holidays in near future, where you would like to go, which places you would like to see, which recreational part you would like to. Today, I think with internet, we can see practically each and everything across the globe, and sort of jot down what will be your future plans. You can visit the best museums of various art and sculptures and for everything across the globe on internet, and then you plan which activity you would like to do in future. I think there are a lot of activities which we have not spent much time on, possibly the family, and understanding them and being with them for a much longer period, and know each other's viewpoint, what they feel like, what are their ambitions, what they would like to do, and things like that.
What is your take on the use of antibody testing kit for testing COVID-19 instead of the RT-PCR test?
Well, I think this is a very good test which will be available to the government as well as the private organizations, which is already being done in most of the private organizations as well as in the government. Another thing is that you can get the results faster and quicker this way, and that's way I think it probably is a good thing, because PCR etc. I think it takes little longer time, but at the same time, you for um, number of tests to be done, maybe this is a better option, which is readily available to us, and it's prepared in India and certified in India. So I think that way we are better off with this at this present moment.
What is your opinion on the way India is dealing with the crisis? Can India manage stage 3 of the pandemic?
Well, yes, I think basically the idea of this particular stage is the community spread of the virus, because that is the most dangerous part, where the numbers could skyrocket, and we may find ourselves to be absolutely not able to handle such a massive number of the patients and deal with them, because we must understand that this is an additional burden, and it's a very, very heavy burden on the healthcare. Apart from the fact that in any case our healthcare is lacking, as if you compare to the developed countries, our healthcare in any case is not as at par in numbers. So I think if you add that corona infection, virus infection, then it would have been unsustainable burden on the health. So I think this particular timing also, I would say, was very correct, because this is the stage when we are entering into the third phase of community spread, and with this social separation and social distancing, I'm sure we will have very positive outcomes, and the number of cases which are detected or which will suffer will will be greatly affected on the less number side. And I'm sure the couple of days, the beginning of 1 or 2, 3 days, have given a hint that our community uh, progress of the disease will be fairly acceptable and much less in number as compared to many other developed countries.
Sure. So, any piece of advice for the healthcare sector?
Well, I think this is a challenging time for all healthcare workers, medical, paramedical staff, and institutions, and it should be done with a lot of commitment. And I'm sure we all are making ourselves ready, and we are almost in most of the institutions, we are fairly well placed to handle the situation. The only thing which I would say that cannot be handled is the numbers. If it is goes beyond, then we may not be able to handle that number. But if our this plan is successful, we will be able to prevent community spread to a reasonable number. Then I think we will all be able to handle this situation.
That's all for now. We will be back again in our next episode with another leading specialist, a master in his or her field of medicine. Till then, stay tuned to the Right Doctors podcast channel. We are available on all leading podcast platforms. Till next time, this is Swati Joshi saying goodbye. Take care, wash your hands regularly, maintain safe distance, and follow whatever directions your health authorities are giving you. Stay home, stay safe. Goodbye for now.
Insights from the world's best medical minds. This is therightdoctors.com.